Clavicle fractures has been an area of interesting study for a long period of time, and it seems as with other areas of orthopedics, the pendulum seems to swing back and forth. And we've had a better understanding of patient experience after both non-surgical and surgical intervention. And so I think this clinical practice guideline is helpful to help hone in and tailor some of our clinical decision making based on some of this new evidence that we've seen. And so we get a better understanding of who really benefits from the surgical pursuit versus non-operative management, and how do we best frame and provide that education to our patients when we're seeing them.
As compared to adults, adolescents do not have the same outcomes. We learned that adolescents, whether treated operatively, non-operatively, displaced, or shortened, they had equivalent outcomes. The only difference was operatively treated clavicle fractures in adolescents had a higher rate of surgery for hardware removal.
The amount of displacement can be a significant factor when predicting healing in clavicle fractures. And when standing upright, which is a more common position for all of us to be in, gravity will exert some force on the shoulder girdle, and that can increase the amount of distraction between the fractured fragments. And so when we're trying to understand in the clinical setting the degree of displacement, as that would guide our decision making, we want to understand the maximal degree of displacement during normal physiologic positioning. And some studies have demonstrated what I think is inherently intuitive, that gravity will increase the amount of displacement that we see on the radiographs. Thus, we find that that's more helpful in clinical decision making to understand the degree of displacement.
We determined that sling immobilization was the best option for non-operatively treated clavicle fractures. This was based on the fact that the sling is easily accessible, easily applied, well-tolerated, and cost-effective treatment of clavicle fractures.
For simple fracture patterns, both mechanisms or both methods for treatment provide sufficient stability for healing. The differences in longer-term complication rates and outcomes has primarily to do with hardware complications or symptoms from hardware with the plate, whereas with the intramedullary device, it's primarily inside the bone and it doesn't cause external pressure as some plates do. So there's less of a possibility for symptoms or hardware irritation related to that. Lateral locking plates, the main premise is that it does not cross the acromioclavicular joint, and the hook plate passes underneath the acromion. And so there's some loads that are non-physiologic on the hook plates that require it to be removed. So one of the first primary issues is that the hook plate requires a second surgery, which adds some morbidity to the patient. And along with that, there have been some well-described issues with the hook plate causing fractures of the acromion, which does affect patient outcomes as well. So the hook plate has some inherent difficulties with its construct and its biomechanics, where the lateral locking plate stays strictly on the clavicle bone, doesn't cross an additional joint, and is able to maintain sufficient rigidity for the fixation.
We learned that non-operatively treated clavicle fractures, smoking had a higher incidence of non-union. When treated clavicle fractures operatively, smoking was significantly associated with decreased patient-reported outcome measures.
The worker wanted to understand if there were some non-modifiable predictors, patient factors that would predict healing rates and outcomes with or without surgery. And what we found was, of the non-modifiable predictors like gender, hand dominance, etc., there was not a wide, convincing body of literature that would suggest that these would be valid or significant predictors for outcomes. So there's still a very limited body of evidence as it pertains to some of the patient factors that would guide our decision making.